Hello, Dr. Amar here again, and in this video lesson we will talk about imaging modalities and their interpretation. If you have any question, you can email me here at ammar@goodrational.com or comment your question down below. Here are the objectives. What we want to get out from this video lesson. We want to understand the types of imaging modalities and what each type of imaging studies is used for. We want to talk about plain radiography or X-rays, contrast agents, subtraction angiography, ultrasound, Doppler ultrasound, computed tomography or CT scan, magnetic resonance imaging or MRI, nuclear medicine imaging, positron emission tomography or PET scan, and single photon emission computed tomography. 10 types of imaging. Now, who's this gentleman? In 1895, Wilhelm Röntgen used X-rays from a cathode ray tube on a photographic film to produce the first photographic film of his wife's hand. And over the past 30 years, there has been a revolution in the body imaging. Let's start with plain radiography or X-rays. It's of course the most common form of images obtained. Now, before interpretation, it's important to know the imaging technique and the views obtained as standard. So what are X-rays? X-rays are photons, as you can see here. These are photons, which is a type of electromagnetic radiation. These electromagnetic radiation or X-rays are generated from a cathode ray tube or X-ray tube or cathode ray tube. So if I order an X-ray of the hand, of the wrist, of the pelvis, of the chest or abdomen and send it to the X-ray technician, what does he do? These X-rays, as you can see here, are collimated or directed through lead-lined shatters to prevent them from fanning out. These are directed or collimated through lead-lined shatters to prevent them from fanning out to the appropriate area. This is the area where the body region will be imaged. This area is determined by the X-ray or radiographic technician. Now, this is an X-ray generator. This is the X-ray film. And this distance between the film and the generator is called the tube to origin distance. In most instances, it's 1 meter. Now, as X-rays pass through the body, they interact with the photographic film. Now, if the area to be imaged has lots of air, as we can see in the lungs, X-rays will interact with the photographic films the most and will produce a black color. So air attenuates X-rays a little. If the area to be imaged has bone or high density and solid structure, it will attenuate X-rays the most and will produce a white color, as we can see in regions where bone is. So bone attenuates X-rays the most. And fat, as we can see here in the axillary area, fat attenuates X-rays more than air but less than bone. So these differences in attenuation result in differences in the level of exposure to the film. Air is black, bone is white, and fat and soft tissue is intermediate in exposure. Now, if we modify the X-ray technique, we can allow a continuous stream of X-rays to be produced and collected for real-time visualization of moving anatomical structures. We're talking about bowel movement, and we use barium studies. We're talking about the blood. So we're talking here about angiography, where we are capturing the blood vessels and blood moving through it. And we have also fluoroscopy. As I have mentioned, in most instances, the distance between the tube and the photographic film is about 1 meter. For example, I order a wrist and forearm X-ray for an ulnar fracture. This object in question, the wrist and ulna, is placed upon the film in here. So when we describe the subject placement for radiography, the part closest to the X-ray tube or the X-ray generator, this part is called the anterior, and the part closest to the photographic film behind is called the posterior. So we can say this wrist and forearm X-ray, and A anterior, B posterior view, X-ray and forearm AB view, and this patient is lying supine. For chest X-rays, it should always be checked for quality. Now, how do we determine that this is a good quality or not? A good quality of chest X-ray will demonstrate the lungs, the cardiomediastinal contour, the diaphragm below, and ribs in here, and the soft tissues. So it should demonstrate a good quality of lungs, cardiomediastinal contour, ribs, diaphragm, and soft tissues. So in most chest X-rays, we have an AB view where the anterior part of the chest is closest to the generator and the back is closest to radiographic film. So it is plain chest X-ray AB view, and the patient is standing. In some cases, the patients can't stand erect, and so we obtain the image when the patient is lying on the bed in supine position. Now let's talk about the abdominal X-ray. Plain X-ray of the abdomen. Most cases, we order a plain abdominal radiograph in AB supine position, as in this picture. This patient is lying supine, but from time to time we order an erect plain X-ray of the abdomen. This patient is standing erect. When do we order an erect abdominal X-ray? When we suspect a small bowel obstruction, as we can see in this picture. This is plain abdominal X-ray, erect AB view. This patient is having a small bowel obstruction, mechanical small bowel obstruction. How do we know that? From the step ladder, air fluid pattern, step ladder, air fluid pattern on the erect film. And that's for plain radiography.